everybody. Hello. Welcome back to Nurse Pronto. We have got some great questions for you today. We're going to break down these nursing concepts so you can pass your exams and survive those clinicals. My name is Dr. October, and today I've got three quick fire nursing questions for you. So let's go ahead and get started. The first one: what is the best position to prevent aspiration in a dysphagia patient? Think about it. It is high Fowler's. Why? Well, because the patient has dysphagia. Whenever they have dysphagia or trouble swallowing, we need gravity to work in our absolute favor. So high Fowler's is sitting them up 60 to 90 degrees and helps prevent that food or liquids from going into that airway, right? Supine, Trendelenburg, or prone, these are all really bad ideas. And here's the reason why. Laying flat increases the risk of aspiration pneumonia. So, and Trendelenburg actually makes it worse because it sends this fluid straight down towards the lungs. Okay? So, yep, yeah, that is definitely, you want to not put them in Trendelenburg. All right, so let's go to the next question. What are your thoughts on this question? I'll give you just a second to come up with the answer, and hopefully you said apical pulse. D, apical pulse. And here is why. Well, I don't know. I having trouble saying that. I have no idea why. But let's talk about why the apical pulse is the correct answer, because digoxin is a cardiac medication. It's used for heart failure and atrial fibrillation. But here's the catch with it: it slows the heart rate down. And the nursing rule is always check the apical pulse for 1 full minute. No, you cannot do 30 seconds times 2 or 15 seconds times 4. It is a full minute on that apical pulse. And if it's below 60 beats per minute, this is what you need to do. You're going to hold the dose and you're going to call the provider. It's not glucose or potassium or the respiratory rate, because potassium is important and it can increase digoxin toxicity. All right. And you do want to assess other things, but the heart rate, apical pulse, it is what we're looking for, okay? Because if we find bradycardia, that can be a really serious complication. So I hope I helped you understand that question. Next one is about isolation. And a lot of people, when I was in nursing school, I could never get this right. So let's talk about it. I want you to tell me the answer to this question. What isolation precaution is required for TB? Well, it is airborne. It is airborne. It is C. TB is spread through tiny airborne particles, which means the standard surgical masks, they don't cut it. So if you have a TB patient, you need an N95 respirator and you need a negative pressure room to prevent the spread. You don't want to get it. I don't want to get it. Nobody else wants to get it. So you need N95 respirator and a negative pressure room, and that is therefore airborne precautions. Okay. Now, why would it be droplet or contact precautions? Droplet is actually for larger particles. I'm not saying there's not droplets with TB. There absolutely is, but it's droplet precautions are for larger particles, like think flu or meningitis. Those are droplet precautions. Contact precautions are for things like C. diff. So think poop. You definitely don't want C. diff. All right. So that's what droplet and contact are for. But I want to tell you though that TB is really sneaky because it lingers in the air, and which is that's why airborne precautions are an absolute must. Listen, I hope you got 100% today. I hope you did. These are our kind of classic NCLEX-style questions, and just so I like explaining like the rationales behind it. So if this helped you, hit a like, follow Nurse Pronto, tag a fellow nursing student who needs a little study break from scrolling, and please come back and join us. Thank you so much. Y'all have a great day.